Good evening, everyone, and welcome to our COVID-19 Community Town Hall, which is presented by UP Health Systems Portage. I'm Steve Elmer. As a member of the Health Research Institute here on our Michigan Tech campus, I want to welcome all of our viewers watching tonight on the Zoom webinar and all of our listeners tuning in on 97.7 The Wolf. It's great to have you back for our second Town Hall. Our featured sponsor tonight is the MTech Smart Zone. For any aspiring innovators out there that have a great business idea, we'd encourage you to go over to their website where you can learn more about their Smart Start program. Our community sponsor tonight is the Upper Peninsula Power Company, and collectively we really appreciate the support of our sponsors. With their support, we're able to do the broadcast here both on the radio and on the Zoom webinar. I also want to recognize the Center for Educational Outreach and the Health Research Institute here on our campus. With their support, we're also able to reach a broader audience. As I mentioned, tonight is the second town hall in a series of 12 events that we'll have throughout the fall, running through December 3rd. A couple of things about our town hall series is each week we will rotate on to a new COVID-19 related topic. Last week, we learned about the role of public health in protecting our community. Tonight, we'll focus on how our community is preparing and putting emergency responses in place during the COVID-19 pandemic. The overall goal of the series is to help increase our collective awareness about COVID-19, how it impacts your health, your family's health, and the health of our community. If you happen to miss any part of last week's town hall, you can go to our Health Research Institute website and you can download the recorded version. That website is mtu.edu/health-research. I want to bring in my colleague and co-host for tonight, Dr. Kelly Kam. Dr. Kam is an epidemiologist by training. She is a member of the Health Research Institute and a professor here on our campus. And I will say that Kelly's been instrumental in planning and preparing both here on campus and in the community. So with that, I welcome back Dr. Kam. It's great to have you here. Thanks for all the hard work you're doing. And I hope you're ready for our second COVID-19 Town Hall.
I am. I'm excited to be here again and to have the community join us as we learn about our different opportunities and different things of how COVID-19 is affecting short and long-term health and of the variety. We think of it often as just affecting health, but the number of different impacts that it has and the response has on our lives, as all of us are experiencing at this time. So as Dr. Elmer said, last week we heard about the public health response and our challenges from the perspective of a member of our local health department as well as one of our local providers. And one of the really overriding themes of that was the problem of misinformation, or what the World Health Organization calls is the infodemic. So the idea of these false and misleading information that disrupts our ability to effectively fight this pandemic. And worker burnout was also a key topic in our health departments. Health departments and providers are now 8 months into this pandemic, as well as everyone else who is responding to this pandemic. I think worker burnout is probably something that everybody is fighting with and trying to address. So an important component of keeping our communities safe is planning for the unexpected. And public and private organizations work to prepare themselves to be able to serve our communities in times of need, and then work together to coordinate our responses to best use the resources of our communities. Now is the time to put those plans into action, and our speakers tonight here provide their insight and expertise in planning and implementing these plans for the unexpected events.
Thank you, Kelly. Based on a lot of the questions that came in last time, for those watching on the Zoom webinar here, we have put down a list of number of important resources ranging from our local Western UP Health Department website, the state of Michigan, the CDC website, the World Health Organization. And there were also questions about some of the testing protocols and procedures and COVID-related procedures here on our campus, and we put that website as well. So be sure to check out these both locally, regionally, statewide, and nationally and international websites here. Kelly, we also put this up. This was another set of questions that came in both last week and even some questions so far, talking about how can we track the cases across counties and across the state. Can you just give our audience a little background on this michigan.gov website here, coronavirus?
So our local health departments report the number of cases into our state health department. So COVID-19 is what's considered a notifiable disease, which means that if someone is diagnosed with it through a physician or through a laboratory, that by law, that laboratory or physician is required to report that information to the local health department, which then reports it to the state health department. Now, COVID-19 is a state reportable disease as well as a national notifiable disease, which means our state then feeds that information to our national databases at CDC. There are also a variety of different websites, such as Johns Hopkins University, their Coronavirus Response Center, that also collect this information from a variety of resources, but they're all coming from this information that's reported from our providers and our health departments and our laboratories. And from that information, we can report the number of confirmed cases, number of deaths, and we can give that information in a variety of different manners. So this is looking at geographical differences of the COVID cases across the state. There are also maps that show differences on age groups, or that not map it by geographic region, but map it by different demographic characteristics, race, or age group. So you can find this kind of information. You can look statewide, you can look nationwide, you can look globally, but you can see that across, when you look at something only statewide, it's a very different picture than when you look at it more granularly and see those differences of what's happening here.
Kelly, one more question for you before we introduce our speaker panel for tonight. So last week, as you mentioned, we were focused on the role of public health. You presented, you had a dual role as co-host, presenter, and even answered some questions and helped me with the questions. But you provided a really good perspective from an epidemiologist point of view, talking really about kind of the global, the world perspective. We did have a public health official, and we also had a healthcare worker interacting with patients on the front line. Tonight, we're going to have both county officials and healthcare administrators here. How will their perspectives complement and extend upon the information and the speakers that we had last week?
So all counties, as our first speaker will reflect on, have plans for emergencies and how to deal with them. I think one of the interesting things for me to look forward to tonight is we often think of emergencies as single point events, as our Father's Day flood or a tornado that hits or a wildfire. But this is an extended response and an extended event. And how has that been different, and planning for that and implementing those plans, and how has that been different from the perspective of planning for it and implementing those plans than something that is a single one-time event, as well as the entire country, and in fact the entire world, is dealing with this, and how do our local responses, especially given this map of seeing the differences of what's happening across our state, so how are our local organizations and our local counties being able to get what they need when the issue is constantly changing and it's problematic in different areas.
Okay, well, we appreciate your perspective, Kelly. We're going to move on and introduce our first presenter and speaker for tonight. So tonight we welcome Chris Van Arsdale. He's the Emergency Management Coordinator for both the counties of Houghton and Keweenaw. Chris is going to help us kick off our second town hall here. So Chris, welcome to the program. We really appreciate you being here. We're going to switch our slides here with the Zoom webinar. And whenever you're ready, just tell us a little bit more about your role and some of the work that you're doing here to help us prepare and put emergency protocols in place.
All right. Well, first, thank you very much for having me. Again, my name is Chris Van Arsdale. I'm the Emergency Management Coordinator. And I'll kind of very quickly, this is a very large event, as Dr. Cam was just talking about, and not just locally, but statewide, federally, and globally. And so I'm gonna, with only a few minutes, kind of gloss over some of the key points. I guess if people have questions about any of these, I could probably talk for some length on any of them. So let me know. So I'm gonna start off by talking about preparation. So what do we do if we can see something coming? And in this case, we couldn't see exactly what was happening, but back really the end of January is when this first started to be on my radar anyway. And so you start to think about what's the organization going to be for the response. What are the objectives going to be? And the primary one for this one is to support the local health department from the county's perspective. And that's because they're going to be the lead agency in this, in a public health crisis. We use a structure called the Incident Command System. We have a local emergency operations center. Those are pretty standard in every county in the US. Kind of the next step is we check in with local agencies and see if they have a plan in place or not, or have they updated it. Some specific things for the pandemic that we ask, things like, are you prepared for significant absenteeism? What are you going to do if 50% of your employees are unavailable? And that really has farther reaching implications than maybe is obvious. Think about, and we're primarily talking about public sector things. So first responders, fire departments, the road commission. Remember, this started back in February and March. What do you do if 50% of the plow truck drivers are sick? What kind of cascading impacts does that have? So things like that. Another big preparation component that we knew was going to come through was resource requirements. Certainly personal protective equipment is a big one, but in general, what's the handling plan? How are we going to handle all of this stuff? Who's going to pay for it? If there's assistance available, either state or federal, who's eligible for that? Is it everybody? Is it just certain agencies? Is it public or private? And then assuming that there's going to be a limited amount available, what is the priority system for that going to be? And who's going to get it first? We also talked a little bit about volunteers. Were volunteers going to be needed? That was a big component of the flood recovery. And so we had some of our EOC or Emergency Operations Center staff work on putting together a volunteer plan. What's the public information component of this going to be? What do people want to know? And that really is a hard thing to judge, because if you know a lot of the answers, it's hard to decide what is important or what do people want to know. In our case, we did resurrect the Copper Country Strong website from the flood. That's a big part thanks to Monty Consulting. They host that for us. And so we've been using that as a method of getting information out. And then also, how do we report back to the elected officials and let them know what the current situation is, and kind of what our plans are. And then finally, on the preparation part, reviewing the laws regarding things like curfews, quarantining, rationing, if that were to become an issue. Who can do those things, and what are the legal implications of them, and what legal authority, who has that legal authority, and what do you need to implement it if need be. On the response side, again, personal protective equipment for this incident has really been the big issue that I've been dealing with. Things like, how do we decide, how do we have a request procedure in place? How are we going to receive this? The county doesn't really have a big garage that we can just unload stuff into a warehouse for. How are we going to distribute it once we get it? And how are we going to track all of it? I mentioned the eligibility earlier about who is eligible and who isn't. On the response side, we basically plan for what's called the next operational period, which in this instance, our operational period's been about a week at a time. So we run through we develop a plan for the first week, and then as part of that, as that week goes through, we plan for the next week. So we're always kind of planning the next period out. The paperwork is significant, especially when you're dealing with state and federal resources. It really is a lot to keep track of, and a lot of requirements to make requests. Things also like emergency declarations, and getting all of those things submitted correctly. Gathering and keeping up with information, and dealing with misinformation, as you mentioned earlier. Misinformation in this incident has really been a significant concern. And for me, a significant portion of my time has been explaining, maybe arguing at times with people about why this is important. And I would say certainly those first 2 months, I spent 50% of my time, if not a little more, just dealing with that on an hourly basis. You ask about somebody's preparedness, and the response is, well, this isn't a big deal, or this is just the flu, or just a whole list of things along those lines. And so arguing with people that we really do need to at least be prepared. Maybe they're right, maybe nothing will happen, but why not be prepared for that as opposed to just hoping that they're right? Coordination between the state and the local level and the federal level. This is kind of a quick chart as to how that typically works. So for everything starts and ends locally. So when there's an emergency, we try and deal with it on the local level. If we need assistance or we run out of resources, we can request that the state assist us. That's done through the EMHSD, the Emergency Management and Homeland Security Division of the Michigan State Police, that reports to the governor. And my contact with them is we have a district coordinator. So the district, the 8th district, is the 15 counties in the Upper Peninsula. And then if the state needs assistance, they can request assistance through the federal level. So that's kind of how that part works. On the healthcare side, it's a little different. And this is an area we've actually had some changes as this pandemic has unfolded. Typically what happens is I interface with the healthcare providers locally in terms of we meet, for example, every month and talk about issues that have come up and preparedness and exercises. They also have what's called the Region 8 Healthcare Coalition, or the Healthcare Coalition for Region 8, that reports, I believe, to the Michigan Department of Health and Human Services, the MDHHS, that eventually gets up to the governor. And so normally what happens for an emergency or for requests is healthcare providers request some of that equipment through the Region 8 Healthcare Coalition, and that makes its way up and back down. So we started off that way, and then it did change. It did shift for a little while. Then we were told that all of that was going to come through the County Emergency Management Coordinator. And then it's kind of shifted back and forth. And the deliveries we get kind of come through both sides of that chain. I've gotten stuff from the Healthcare Coalition to deliver back out to the healthcare providers. And I've also gotten stuff that I've requested through the state down through the EMHSD side. So that's been kind of a confusing component of this. It has worked out, but some shipments maybe arrive without knowing who it was coming from. So some specific issues of concern. I mentioned misinformation. That really has been a big issue all the way through this. And so the importance of having good sources and listening to the experts is really crucial. Tourism has been an issue for a couple of reasons. On the one hand, there's the potential for spread, especially early on, where people were kind of escaping other areas that had more cases to come here. On the flip side, this region really depends on tourism for economic stability. And so how do we try and balance those as much as we can, if we can? And of course, compliance with executive orders at the same time. On the schools perspective, both the universities and K-12 schools worried about breaks. So this really came to a head basically the week of, or the week before spring break. And one of the questions I was asking was, well, do we encourage schools to cancel spring break and just let everybody out a week early in the summer and hope that maybe it's better by then? Or what other plans do they have in place? Especially students that are living on campus, that's very close quarters. How do we manage all of that? Returning snowbirds, there are a lot of people who live the winter time in a different area, and in the spring as they're coming back, what message do we put out to them about what we're doing, what they should do, what they can do to protect themselves and to protect the community they're coming back to? We have a ton of local festivals and events. There's one at least just about every weekend in the summer. So what kind of planning are they putting in place? What are they going to do if people don't follow their instructions, saying, what if they don't social distance? It's one thing to have the plan, but if the people coming to your event don't follow it, is it really doing any good? Trying to avoid the super spreader events. Another issue that's come up even locally are issues with violence. There've been a couple of people in Michigan shot trying to enforce masking rules. And we've had threats here in our own county, actually with people in stores threatening actually public officials who are trying to help the store comply with regulations. So another question you ask about is kind of the difference between short-term and long-term, or acute or emergent issue or incidents and timely warnings. In general, and we'll use the flood as an example of an acute one, but so we do have these general plans, but to refine them for that particular incident, you really are doing it on the fly. So it really is a quick pace as a result. So for the flood, we were doing kind of update meetings twice a day on certainly for the first month, and then once a day after that for another month or two after that. So it's much faster paced. There's a lot of burnout. That first week of the flood felt like a month. The first 2 weeks felt like 6 months. So that is a big concern. The adrenaline from the incident will only take you so far. So in contrast to that, kind of on the long term, we did have a little more warning in terms of planning some of these things. So we can refine some of our plans, identify some of the gaps earlier on. The pace is much slower. So instead of updates twice a day, we're doing them about every 2 weeks. And that's actually slowed now 7 months into this to about once a week. But burnout does still happen. It's a different kind of burnout, but it definitely, you get tired of getting up and doing kind of the same task the next day, and especially when numbers start to go up. And then there's a loss of interest, and for some responders, that's a lack of excitement. Like they're there in the moment and it's exciting, but it also, because this is so drawn out, keeping people excited about it is sometimes a challenge. Some quick recommendations. I know there are a lot of people in the community and students that are nervous, especially given the numbers this past week. And the big one I have is this isn't over. I hear that a lot, that, well, we can all go back to normal, and we're not there yet. Following the guidelines is really critical. Masks, hygiene, those types of things. Avoiding travel. If you don't have to go somewhere, it really would be better not to. And if you have visitors that want to come and visit, it really is better if they don't. We really don't want to deal with more spread either out of the area or into the area if we can at all avoid it. Keeping up to date with information really takes a lot of work. There is a ton of information, and I have been getting, certainly the first few months of this, probably more than 100 emails a day, most of which are sometimes 10, 15 pages long with, well, here's the latest information and the latest guidance. And sifting through all of that is really a challenge. The other part is, once you know it, it can change. This is a very dynamic thing. And the experts, as we learn more about it, are telling us, nope, maybe this isn't the way this works anymore. This is how it's working. So knowing that is really important. And really the big takeaway is, think about the others in your community. This isn't just about us as an individual. It only takes one person to really cause havoc. And I think that's a message that maybe we haven't gotten out there real well. And just a couple of, one last slide. And these are frequently asked questions. The first four are more what I get asked all the time, maybe sarcastically or not. But isn't this just the flu? No, it is not just the flu. Don't people die anyway? Yes, people will die eventually anyway, but that doesn't mean we want more to die sooner. That's why we're doing this. Aren't we all going to end up with it eventually? I don't think that's necessarily the case. But more importantly, we're trying to not overwhelm our healthcare system. And that's one of the reasons all these precautions have been in place. And another common question I get is, why isn't more data released about who is positive? Especially when we had the first couple of cases in the county, that was a very frequent complaint that we got from the community. And I kept responding by saying, well, think of it this way. If I told you that the positive person was at store A, your response might be, well, then I'm not going to go there. But that doesn't mean that that person hasn't been to other stores. It doesn't mean that that you won't encounter them or other people who we don't know are positive in the community. And if you go outside, you should assume that you're going to come in contact with somebody who's positive and take the necessary precautions, which was actually why we had the stay-at-home requirement for so long. Another common question is, where can I get tested and how can I get tested? So if you're showing symptoms, especially, or if you've been in contact with somebody who has tested positive, you should contact your healthcare provider. The availability of testing it varies from week to week depending on the lab capacity. So, but the first step is to contact your healthcare provider and let them know why you think you need a test. And they can direct you from there. If you're a student, there's an email you can send to the Michigan Tech Flex group that will also help you if you're on campus or a student off campus. The other big question we get is, what do we do if businesses aren't enforcing the mask policy, or if somebody isn't wearing theirs when you go to a business? This is kind of a delicate situation. If it's a business that's not following it, you can report them to the state through the Attorney General's office. If it's a person that isn't complying in that business, you have a difficult choice. You can, probably the best thing to do is to, if you're going to say something to them, to make it positive. For example, like, oh, I noticed you don't have your mask. Did you forget yours? I've got an extra one for you, as opposed to just shouting at them that they're endangering everyone. So, so that kind of thing, I think the kindness of being kind to each other is a critical piece of this, especially at a time when people are really tired. There are a lot of raw nerves. I think that's perhaps the big challenge that we face.
So Ed, thank you for your presentation. I have one quick question here before we move on to our next presenter. I know the CDC has a marker of how vulnerable and resilient communities are. It looks like our local area is at a moderate to high level of sort of vulnerability. Can you just elaborate on why that metric or that index is important at all, and kind of where we fall compared to other communities here in the UP?
Yeah, so and I'm not sure I'm thinking of exactly the same one that you are, but I know there's one, are you referring to like the Safe Start map?
Yeah, yeah.
Okay. So I actually cut those slides out of this presentation because I was worried I would talk too long. But so there is, actually, let me just show you. There is what the health department has told me is called the infectivity rate, which to me is really more startling than just the number of positives. So let me just show you what I had cut out here. And so there are three graphs here. The one on your left, when you look at this, is Houghton County. This is as of the 7th, so Monday, and you can see that they measure this in cases per, or sorry, infections per day per 1 million people. And so if you divide out our population, on Monday the number was 216.1, which categorizes us in very high. So if you look at the legend on the bottom, you can see high actually is just 40 to 70, and very high is more than 70, and we're at 3 times that. And just for some perspective, I put up the one in the middle is from Wayne County on the same day. They were only at 56, and Kent County is only 38. And in fact, if we look at the peaks of those two locations, you can see the peak in Wayne County, and this does exclude the city of Detroit, but the rest of the county, their peak was at 237, and Kent County was at 176. So in Houghton this week, we are actually, considerably higher than Kent County and almost as high as Wayne County was in terms of infectivity. And to me, that number is really more striking, to say that the odds of you, maybe not the odds is not the right word, but the potential of infection in Houghton is higher than in these major cities or major population centers, to me is really scary. I think those are based on how many infections we've had. So it's kind of like, what is the rate of change as opposed to just the total number. So, if you want to look at, well, like, why are we at higher risk? That's a good question. We do have a lot of tourism. We do have a lot of people who come back. If you look at a percentage of the population that are I would call them transient population, our student population or our snowbird population is pretty high. So that could be some of it, but those are kind of speculations. But those certainly are potential contributing factors. So.
Okay, thank you, Chris. If you are just tuning in on 97.7 The Wolf, we're here for the COVID-19 Community Town Hall. Our topic tonight, we're focused on how our community is preparing and putting emergency protocols in place. You can join us over on the Zoom webinar by going to thewolf.com and clicking on the link. I also want to mention our sponsors for tonight include UP Health System Portage, the MTech Smart Zone, and Upper Peninsula Power Company. We're going to move on to our next speaker. We welcome in Ed Freisinger, who is the Chief Executive Officer of UP Health System Portage. So Ed, welcome to the Town Hall and thanks for being here.
Yeah, well, thank you, Dr. Elmer and Dr. Camp, for not only hosting, but organizing tonight's event. So thank you very much. And I'd also like to make sure we recognize and thank our first responders, all of our healthcare professionals and others in our community that have been here, not only taking care of our patients, but taking care of each other. And similar to what Chris was saying, is to also thank and recognize the community for taking care of each other by wearing masks, washing their hands, and practice social distancing. So I really want to thank you all for that. I'm going to talk a little bit about how we've responded here at Portage Health. And I want to start off though with our mission. And our mission is to make our communities healthier. And that's how we always start everything that we work on as an organization. And in support and in service to that, in the COVID-19 scenario, we've been very diligent in a number of areas, but the focus has been on certainly the understanding of what's going on, the development of action plans and programs to address what we see and what we need to do to prepare for the COVID scenario. We've implemented a variety of strategies, and then we've been on a journey of continuous evaluation and review. For those of you who are familiar with lean systems or continuous improvement, it's a plan, do, check, act cycle is basically what we've been in here. And one of the questions or one of the thoughts that came up as Chris was presenting is, what is one of the major differences between kind of an individual one-time event and this one that has been over, really a period of months? And I'd suggest it's resilience. It's that we as a community and as providers have been resilient in terms of what do we know, what do we understand, and how do we need to adapt on a very regular and ongoing basis. And as a part of that process, we've opened a command center similar to what Chris identified. And the command center is set up to do a variety of things. One of them is look at operational systems and structures that are in place prior to an event, but how are we understanding that event and changing our operational structures? How are we understanding logistics? There was discussions about personal protective equipment. How are we going to screen? How are we going to test? All of those types of activities are there. Also looking at interagency coordination. And again, Chris, I think you did a very nice job highlighting some of that. But not only how are we doing it locally within the Keweenaw Peninsula, but how are we doing it across the Upper Peninsula? I know that Christine, who's going to talk in a moment, she and I have been on regular calls with our peers across the Upper Peninsula about what is going on, how are we prepared, what are questions and best practices, so that we're sharing it in a very thoughtful, I think, collegial manner. Also, our hospital association and others have been involved in, again, how are we understanding what others are doing? And more importantly, how can we send questions out to others who are working through scenarios to learn from others' experiences? Also, making sure that we are addressing the clinical needs of our community and understanding and maintaining our compliance with all of our regulatory requirements. And, I really do enjoy the term, the infodemic. I think that is a very, very apt item for us or consideration. And what we've tried to do here is focus on, again, what do we believe are those good sources of information, and what are the good items that are giving us direction? And one of the major ones, of course, are the executive orders through the governor's office. We need to make sure that we are not only aware of them, but how are we understanding, comprehending them, and as appropriate, then adjusting our operations to comply with those. Also, CDC guidelines. How are we understanding, again, CDC guidelines and changes to make sure that we're in line with that. And ultimately, that's in respect to the environment we're in. What is our experience? What's our prevalence? What's the hospitalization rates? What are supplies? What are testing capabilities? All those things. So you have to put it all into the context of the environment with multiple inputs that are going on. And so some of the questions that we've been addressing here is, when are we open? How do you get into the hospital? Well, we're open 24/7. We are a hospital that's open to care for our community. And we have 2 entrances in the hospital. Well, when you come to the hospital, you would expect to be screened. You'd go through the screening questions, and you're going to have a temperature taken to make sure that we understand from you, do you have any exposures or anything that would preclude you from coming in, to protect our patients who are vulnerable, to protect our staff, and ultimately to protect our community. We've got universal masking policy in place. That if you're within the facility that you're masking, again, these are set up to help protect each other in this scenario. We also are managing our visitation here. If you are a patient within the hospital, you have 1 visitor that can come to see you. And again, that's not to preclude you from seeing people. It's so that we are understanding and limiting exposure. Because ultimately our role and responsibility in keeping communities healthier is to keep you safe and our caregivers safe. And within Portage Point, which is our long-term care facility, we've limited even more for visitors to very narrowly defined parameters. And we are on a weekly basis testing all of our staff there. Again, that's an interest and in service to protecting our residents within the long-term care facility. The question is about how are we keeping clean? Well, again, our staff is here, they're cleaning on a continuous basis, and we're continually, again, using CDC guidelines and other direction to help us maintain a very safe and clean environment. Supplies has been a big item for all of us in healthcare. The personal protective equipment, whether it's what we have locally, being part of a system and being part of the network in the Upper Peninsula, we've shared PPE amongst different hospitals up here, and even within LifePoint across the country. We, as necessary, have received or sent supplies to others who may be in a different state, who may have a demand that's higher than us, a hotter spot than what we're in. And conversely, if we need it, we have access to some of those supplies through those relationships as well. Another item that comes to play is, what's our surge plan? What happens if we see a major influx of COVID patients or any type of patient? And we've developed, and we have it prepared, ready to go. Unfortunately, we've not had to implement our surge plan. But on a normal basis, we can accommodate, a normal patient load within the hospital. If we see that we have a surge and an increased demand for what are called negative pressure rooms, we have the ability, because we have retrofitted rooms, to expand the number of negative pressure rooms. And if necessary, we can actually turn a whole wing into a negative pressure wing so that we can, again, serve our community. If we outstrip our local capacity here, we would partner with our partners at Aspirus or in Baraga or in Marquette or elsewhere in the state as necessary. So we have a very thoughtful escalation or surge plan to meet not only the immediate needs, but we believe the medium and long-term needs of the community. Another question we get, and Chris, I think you talked about this a little bit, is, well, why in the world can't we just have an approach and stick with it? It seems like the rules are changing on a daily basis, and sometimes twice in a day, it feels like. And we have staff members, we have community members going, why can't we just have one approach and stick with it? And that's because that's not appropriate. As we learn more, and remember, this is a new disease process. And as we learn more, we need to adjust. And as we're adjusting, we're changing operations, we're changing practices, because that's the right thing to do to take care of our community and keep our patients, our employees, and our community safe. So in closing, I just want to do a couple things is to remind folks that, number one, if you need health care, please contact your provider. If you need emergency care, please come in. We are safe. We want to make sure that you're seeking care, because we have seen or we've experienced where people have delayed their care because of their concern. Please seek the care that you need. And again, to support what Chris was saying earlier, is wear your mask, please wash your hands on a regular basis, and practice social distancing. Oh, and finally, get your flu shot. Flu season's coming.
So Ed, yeah, thank you for the presentation. And I'm getting a little bit of an echo here. A quick follow-up question for you, Ed. For those patients that and community members that might be hesitant to come in to the hospital, what options do they have for telemedicine or remote care? Could you comment on that briefly?
Yeah, so there's a variety of options, and so we work a lot with UGL, which is the Federally Qualified Health Clinic. They offer telemedicine visits, and then we offer telemedicine visits at the same time. If they wish to go to one of our express care centers, they can call ahead of time. If they want screening, we can set up screening where they can come out and do the screening from the car if necessary to help them feel more comfortable.
Okay. And then what type of technology would they need at home? Thinking of people with maybe a poor or don't have internet access. Can you comment there?
Well, a phone, because you could just use a phone call to have that. If you have video capabilities, that can enhance the visit. But a phone, at least the phone call into your provider, can at least engage the conversation, and then your provider can help guide you as to whether or not you need to come in or maybe seek other approaches to care.
Okay. Thank you, Ed. Next, we welcome in Christine Hart. She is the UP Regional President for Aspirus. So Christine, we appreciate you being here tonight, and thank you.
Thank you so much. Chris and Ed have both done a great job here, and I can't stress how the collaboration between UP Health Portage, our Department of Health, and our other partners has made a big difference for all of us, because we're all here with the same mission to strengthen and keep our communities healthy. So I want to do a shout out to everyone on that as well. I'll try to talk about a few different things, not to belabor, but I think misinformation is the biggest problem we've had. We've had our patients call and say, oh, there's 10 positive patients in the county now. They must all be in your hospital. It's not safe to come in. And so if there's one message I can get out, I can tell you that all of our 4 UP hospitals here, as in Ironwood, Iron River, Ontonagon, and Keweenaw, what we're seeing now is healthier patients that are at home. They're not in the hospital. They're not on ventilators. I think, again, a lot of misinformation. So thanks, Chris and Ed, for really doing a good job of explaining that, because we have had some patients that are delaying their care. We're very safe as well. Our staff, you'll see them with masks and face shields on. We've developed what we call a respiratory clinic. We've actually converted the Lake Linden Clinic just for that. You'll see drive-up areas where you can get testing done. Again, we are very, very safe. You'll come in, you'll get screened much like Ed spoke about. We actually have stickers on the floor to mark out what 6 feet is, because I think Some of us just aren't so distance aware, honestly. So we tried to mark that out for people and be very, very careful. So again, my big push would be don't delay care. We've actually had a few patients that congestive heart failure, et cetera, some chronic patients. We have virtual visits as well. Again, Ed did a great job of talking about that. So that would be my shout out. Call your provider, because we are safe and we want to keep our communities healthy. Again, that's a big part of our mission as well. We have our Incident Command Emergency Operations Council set up with WASA and all of our hospitals in the beginning. Obviously, we created big surge plans, much like Ed talked about. We've converted some wings. We've talked about how we could use all 4 hospitals and make 1 or 2 of them non-COVID. We have very, very robust plans, but again, we are thankful to date we haven't had to use those. Again, it's like Ed has pointed out, it's great to have a system. We are able to share supplies. We are able to vet out PPE. One of the things we ran into is some of our protective equipment wasn't of the quality we would like. So we worked really hard to make sure we can keep our patients and our staff safe and quickly vetted any equipment we have out to make sure we are safe. We use the CDC, much like you've heard. We have an epidemiology on our EOC and WASA when we virtually get together, much like the Zoom meeting. Things change quickly. We have one person, again, just that resident expert. Their full-time job is to make sure we're up to date. We've had to create an internet site because things change so fast for employees. So again, they're screened at the door as well. They come into work. They almost have to check it daily because, like, again, Ed did a great job of explaining as things change, we're trying to change as well. In closing, again, stay safe, do the right thing. I think I loved hearing Chris say, be kind. To me, wearing a mask is your visible sign that you care for humanity and you're here for your community to not spread it to others. So we really want to thank the community for doing that and encourage that. And instead of talk on, because again, I think the other 2 speakers, I rather hear people's questions and try to address those concerns. But again, if I could drive one point home, that misinformation, again, we were just told again that by a patient that they felt unsafe because we had all these inpatients, and honestly, we just don't. So, but please call your provider and take care of yourself during these times. It's been stressful on our staff, on our community, on everyone. But again, if we all work together, I think we can, combat COVID.
Now, Chris, you mentioned the 4 hospitals here in the UP and also your clinics and hospitals across the border into Wisconsin. With the different executive orders by the respective governors in each state, do your protocols differ here compared to WASA, or is it kind of a one-size-fits-all and they're the same at every Aspirus clinic and hospital?
You know, we tried to always work to the stricter, but there are some specific differences, and on our daily, when we had our daily huddles, we've kind of moved to weekly now. Our expert would point those out. We did a really good job. We appreciated the having the clarity from the governor, and we're able to meet those guidelines. Obviously, the states are different. I'm not going to say they're similar, but here in the UP, we always went to usually the strictest interpretation.
Okay. Thanks. So we're going to open it up to more questions here for the panel. One that came in here, this is a great question from a community member. Are there other communities out there that you are modeling after? Communities that were impacted by COVID-19, maybe downstate or out of state, that responded really well, and communities that didn't respond that well? So I'll start and open it up with Chris.
Yeah, so I wouldn't say specifically that we've modeled our response after any other communities. We do talk frequently with So the Region 8 emergency managers, so the 13 of us in the UP meet fairly regularly and discuss kind of what everybody else is doing. And then the state itself has a conference call. I think at the beginning we were doing 3 days a week. And there's like 150-ish emergency management coordinators in the state. And so they would kind of give us their updates directly, and then you could ask questions, and they would answer them. And they always had kind of a different guest speaker, so to speak, every call. So sometimes it would be like the school superintendent for the state, so things like that. But it did give us an opportunity to kind of share what worked and what didn't work, and what other counties were having problems with. And a lot of those are things that we've mentioned here tonight even. So I wouldn't say specifically we model it after them. All of the emergency plans have to meet FEMA's requirement in terms of what they contain. And so in that regard, I mean, they're all similar, but the specific things that we do, the way we do public information, for example, or the website, or how often we do it, those are kind of different depending on which county you're in and what their procedures are. Some of it is a lot of it is actually a staffing issue. So out of the 13 emergency managers in the UP, there's probably only 6 or 7 that are full-time, and the rest are part-time. And so they're trying to manage this on 20 hours a week. And if you ask them, they will tell you that's not the 20 hours they were expecting to spend a week. So.
Okay. Thank you, Chris. Another question came in here, and I'll open this up to Ed or Christine. You guys both mentioned the CDC guidelines, how they're changing. And one recent change was talking about those folks that are asymptomatic do not need to get tested now if they've been in close contact with an infected person. So from your healthcare perspective, how have your organizations interpreted and responded to that change? Yeah, go ahead, Ed.
Okay. Well, sorry about that. Well, again, what we would do that then is, based on the information, is we would adjust how we would do testing and screening for different procedures within the hospital. And, based on that, then we would look at it and say, how can we use this guidance to help manage what are, in some instances, some scarcer resources, especially in the testing arena, to make sure that we're focusing testing on that population that is the highest priority.
Okay. And I can add to that as well. I think we've looked at our employees differently too, as guidelines have changed. When do we test an employee? If they travel, it all impacts how we do that work as well. I can give you examples. For certain procedures, even though some would consider something, one of our orthopedic surgeons, for certain fractures, we might, if we can, wait to do that for a test because we know blood clots, as science finds, was an issue with COVID, and we knew someone is at risk. We might change when we do a procedure. Again, we try to use the guidelines and the changing environment. This is science. We're learning. It's not Encyclopedia Britannica. You can open up and here's what you do. So we have changed accordingly on all those things that we learn.
Okay. Thank you to Ed and Christine for your insight with that question. Next question for the panel here that had come in from a community member is, what capacity do we have here in the Western UP to treat COVID patients? For example, the number of ICU beds, ventilators. When would a patient be sent to Marquette or downstate or Wisconsin, Green Bay, Wausau?
I can go ahead and start here in Keweenaw. We, again, as part of our plans, we probably have 14 ICU beds we use directly, but again, we could move patients in between our 4 facilities. We have worked with UP Health System. We would utilize Marquette. We would utilize WASA. WASA was actually built during the first SARS epidemic. So have an entire tower that has negative pressure room just because of the timing when that was built as well. But again, other concerns we've talked to through our surge plan is a number of staff that would take, because we staff for our normal daily numbers of patients. We've had a lot of our RNs at our clinics cross-trained and have tried to work through some of those scenarios as well, because like we talk about PPE, we talk about staff, we need every resource. I think Chris did a great job of, we have to have all these resources to make it work. For example, we do have testing capabilities, and the federal government has stepped in and allocated those reagents to other hotter spots. So all that would play into our surge plans as well. So being part of a system, we would all have to work together with Bariga, UP Health, and all of our neighbors, and would have, if for a surge, we would speed up those calls again and probably be on daily calls. Ironwood probably has a very similar capacity to Keweenaw. They might have some more areas. But again, we have pretty robust plans. We have a guideline that all of the UP hospitals agreed to for when we would shut down, when we would expand. So we would shut down, for example, elective surgeries when this happened. It's all very laid out. And I think we can thank the Minnesota Hospital and all the hospitals for getting together to collaborate and have that kind of plan. So I feel very comfortable we could, again, handle a surge.
Okay. Thank you, Christine. One last question here as we start to wrap up. The elephant in the room is the cases have increased considerably here in Houghton County over the last week. And unfortunately, we had the first reported death as well. What would be the main recommendation that you have for the community as we move forward into the fall, into the flu season?
Well, I think, again, it comes back to, wear our masks, wash our hands, and, practice the social distancing. I've talked to colleagues in New York when it first really started hitting in New York, and they were professing back at the beginning, wear a mask, wash your hands, and practice social distancing. Those are our 3 best defenses right now to avoid it. And if you do end up being diagnosed with COVID, then you want to certainly follow the recommendations and guidance you get through the health department and your physician.
Okay. Thank you, Ed. I want to bring my co-host Kelly Cam back in. Kelly, there were a few questions here about contact tracing. I know we're going to talk more about contact tracing coming up in a couple of weeks, so stay tuned for that. But anything stand out from your perspective as we hit the home stretch here in our town hall?
Sure. So I think the idea with the contact tracing is to be able to find out who are those people where the infection may have spread to, so that we can make sure to keep those people away, so we can stop the chain of transmission at that point. So all of those ideas that everybody has mentioned that we all know of washing our hands, wearing our masks, staying far apart. In real life, often that doesn't always happen. And so the contact tracing has been the next step, so that we can find those people who may have been exposed, and they're already, if they were exposed, they may already be infected and not know it. And so the next step is to try and remove them from interacting with everyone else in the community. It's a big step to do that. It's a lot of work, as we'll hear about in the future. But it is an important step that we then all must need to take, and realizing that it's also on all of us that if we are identified as a close contact or an infected person, that it's important for us to stay away from other people. And that's our individual responsibility to our society to make sure that we stop the spread of this. And also for everybody to just keep doing, as everybody said, wash your hands, stay apart, and wear your masks.
Okay. Well, we appreciate all of our presenters tonight, Chris Van Arsdale, Ed Freisinger, and Christine Harf. Thank you, Kelly, for your perspective. We will be back here next week, 7 p.m. Eastern. We'll be moving on to a new COVID-19 topic focused on how COVID-19 impacts the human body, so stay tuned for that. I do want to thank our sponsors again, our presenting sponsor, UP Health Systems Portage, our featured sponsor, the MTech Smart Zone. Be sure to check out their website to learn more about their Smart Start program. And then finally, Upper Peninsula Power Company. We appreciate the support from all of those sponsors to help us reach our broader audience here tonight. So until next week, have a great rest of your evening. Stay safe and be healthy. Thank you. Okay. See you guys later. Thank you.